Joe Zarzaur here with Dr. Malone to talk a little bit about COVID again, unfortunately. Things are a little out of control in Santa Rosa County, so I thought it would be a good time for Dr. Malone to share the numbers with us so that folks in Santa Rosa County can take a peek at what all is going on. As we've been doing these videos, we've been monitoring fairly closely Escambia County because most of the staff lives in Escambia County. And so we've been sort of paying attention to those numbers. But of recent, I'd say since the bridge went out, there's starting to be a big difference between the Santa Rosa County numbers and the Escambia County numbers. And I think a lot of that has to do, or Dr. Malone has opined, that a lot of that has to do with there's less testing available in Santa Rosa County than in Escambia County. And so people over there are not, there's a lot more people over there running around with the virus that may otherwise have been tested that aren't getting tested because they got to drive an hour and a half potentially, or an hour to get tested, hour and a half both ways. But so Dr. Malone, pull up those numbers for Santa Rosa County. Of course, Escambia County is not exactly perfect either, but Santa Rosa County is getting way out of control.
So these are the gross numbers, I guess, just as far as the positive numbers from the last 2 weeks here. So today's release was the data from yesterday, so 118 positives. You know, and Escambia County's been higher than this number-wise. You know, you have to grade it based on the population and all that, but this is what was concerning, and it grabbed my attention, and obviously shared it with Joe, was this. It's the percent positivity.
Well, yeah, and if you put that percent positivity and you look at that trend line next to Escambia's trend line, it's double or triple, right? Double for sure. Yeah,
and so we're 10%, 9 or 10%.
Yeah, so it's 25%, 2.5 times what it is over in Escambia County 2 days ago. And just anecdotally, why don't you, without using the names of any businesses, Evan, why don't you share? We have a couple Santa Rosa County employees that have been making that drive, and one had a family member that had contact with somebody that was positive, and so that person was trying to get tested. And Evan, why don't you run through what problems they had?
You know, we're all very familiar with the Escambia County testing options here. We've been through it where we've had staff members or family and friends of staff members who've had to be tested through the Sacred Heart system, through the Department of Health. And then obviously there's some private enterprises that testing options are available for Escambia County, readily available. And, you know, we've been using one at the firm here where we use PCR, which at the moment is the gold standard. So I had to do a little bit of.
And I don't think you were clear on that. The test is a PCR test. We've been talking about that, but that's different than the antigen test that's quick and gets you a quick result. The PCR test is the one that you have to get a lab to do, and it usually takes between 24 hours and 5 days. Well, it seems to be taking closer to 5 days in Santa Rosa County. Go ahead, doctor. Sorry.
Yeah, that's fine. And so, you know, I had to do my homework on what options were available in Santa Rosa, and, you know, that's Monday through Friday, and it was like Monday, Wednesday, and Friday we're at one location, like Tiger Point. I think Tuesday and Thursday we're the Milton Community Center, and it's very limited hours. So right away when I was looking that up to try to help out someone who was asking for information, it was a little bit disconcerting. And then it was, you know, make an appointment to go to a lab and get a rapid antigen test. And the rapid antigen test, really, it's guidance, but it's not useful unless you have it coupled with a clinician who is guiding you to listen to your symptoms, know what next step to take if it's positive or negative in your situation. Like, do you need a confirmatory PCR test?
Yeah. Or so this person got this family member of a staff member got a antigen test finally when he finally found a place in Santa Rosa County that would give him the test. And he got the test and it said he was negative, but he had all the symptoms of COVID. And so 2 days later or a day and a half later, he goes back to does a virtual appointment, I think, with his primary doctor. And the primary doctor says, you have COVID. Like, there's no doubt in my mind you have COVID. And so they start treating him for COVID. We then arranged through our testing service here at the office to have them contract out and get their own PCR test that they basically self-administered. And now we're waiting on that. We should have it tomorrow around noon, I guess, right? So one day.
Yeah, it's been a pretty reliable turnaround. Like you said, about 24 hours, give or take. Sometimes sooner, sometimes a little bit later, but it's pretty reliable. And it's something that allows us to pivot as quickly as is reasonably possible with the PCR testing right now, instead of a 5-day lag. I mean, what do you do for 5 days? And in that situation where you say, oh, I had a negative rapid antigen test,
All right.
but no guidance, that's kind of, it's almost not worth doing the test.
Right. So the reason that I feel like it's important to do a video today was that if you're listening to this and you're in Santa Rosa County and you're going to the grocery store over there, or you're going out to restaurants over there, or you're doing anything out where you're coming in contact with people that aren't masked and that are within 6 feet of you, there is a greater % chance you're going to be exposed to the virus than if you're doing that same thing here in Escambia County. So whether you believe or not that you're going to get really sick from this is really beside the point. But what you need to understand is that you're got a lot better chance of coming in contact with this virus if you live in Santa Rosa County right now than Escambia County. And that's why I felt like it was necessary to perhaps share this with those of you that are in the audience in Santa Rosa County, because it's important to sort of understand the context of these numbers versus Escambia, because we've been looking myopically at Escambia and not really looking at Santa Rosa as much, because they have historically been lower than Escambia. And now all of a sudden, Santa Rosa is 2.5 times what Escambia is. So,
yeah.
Go ahead, Doctor.
Well, and I just wanted to add that, you know, any of the rapid tests, I mean, I'm not saying that they're bad, but they can't be treated as, oh, I'm clear and I can go about my way. You need to frame it in whatever situation applies to you, where like, I might need to do more testing. Like, it's not the end of the road. It's the, let's take this to the next step, or let's listen to the guidelines on isolating while we wait for the next test or while we consult with a clinician. So it's not a drive by, get your rapid results 15 minutes later, and then you can go to the ball game or whatever and act like you don't have it, because you still may, or other people around you may. And that's how we're seeing some of these outbreaks.
Well, and next week is Christmas, and so it's trending in a really bad direction in Santa Rosa County, and frankly here too, but it's trending in a really bad direction. And if all these people in Santa Rosa County all of a sudden get together next week on Christmas Eve or Christmas Day or whatever, and then they share the virus with each other, then those numbers are going to obviously go crazy. So wear a mask. The chances of you catching the virus, if both parties are wearing a mask, are like in the single-digit % numbers. So I encourage people to wear a mask, wash your hands often. Of course, these videos, I'll talk about those things that you can do. Dr. Malone is going to post the stuff underneath this video, the links to the various reports, the Escambia, the Santa Rosa. Perhaps we'll post links to the places you can go in Santa Rosa to get tested. Maybe it might be worth your time to drive over here and get tested at Escambia County, just so you don't hit the rush hours. But either way, y'all be careful out there, wear a mask, and we're going to come next week and do a video on the vaccine, but I felt like it was important to talk about these numbers this week. We'll watch them for you, and if they get crazy, any crazier, we'll let you know. Thank you very much. Thanks, Dr. Malone.
Thank you.